Hi, good evening, everybody. My name is Brittany, and I'm going to be discussing Chapter 15 Risk Management in Ambulatory Care Settings. My first slide, introduction. Ambulatory care managers and clinical leaders need to have an effective plan in place to limit the risk, even more importantly, if they are not subject to accreditation. They need to constantly assess the vulnerabilities of their sites that could cause risk. These risks include harm happening to patients, visitors, and staff members. There are several malpractice claims that are paid out every year, and there are now a higher number of claims coming from the ambulatory or joint ambulatory inpatient setting. Most of the malpractice claims were from the inpatient setting alone before, so changed quite a bit. Next slide, please. Assessment of practice setting. There's a modern model for managing risk, and it relies on the total assessment of each practice settings. So they are able to identify any potential flaws that could create harm. There are three core principles: culture of safety, good employment practices, and ethical business practices. Next slide, please. Assessment of practice setting. Researchers established that the key element for minimizing harm to patients would be the culture of safety. The significance of this approach is that human errors happen in any work field, especially in the healthcare field. Everything does not always go as planned as we plan for it to go. The four culture of safety key features are fairness, transparency, active leadership, and psychological safety. Next slide is good employment practices. It is very important to know that the physician or the owner It is very important to know that the physician or the owners of the practice can be held legally responsible for the actions of their employees. For example, nurses and nurse practitioners, LPNs, CNAs, medical assistants. The severity of the claims are very high, more than one-fourth involving death of patients. Each state has their own regulations that they follow regarding the policies and practices to help prevent harm to their patients. Next slide. Good employment practices. The hiring process needs to be the same for everybody across the board. Having the proper documentation from the employees is the employer's responsibility. Excuse me. If something bad were to happen and the certain paperwork was missed during the hiring process for an employer, it can be cause more issues for the company. Having well-trained supervisors and employees who work together as a team to help create excellent care to the patients will have a lower risk of healthcare errors and mistakes with the patients. Employers who report a company for fraudulent billing will be protected by the whistleblower law. Good employment practices. Next slide. There needs to be an employee handbook given to all employees which explains the policies and procedures and their specific job responsibilities. The practice management team needs to make sure all new hired employees attend orientation and training. It happens quite often that you have an employee who is out sick or on vacation and someone has to cover for them. There are great risks when you have someone doing someone else's job who has titles and credentialing. For example, a medical assistant giving a patient their medication or injection. Those procedures are out of the medical assistant's scope of license, which is a big no-no. Can't do that. Next slide. Good employment practices. The initial process should be devoted to training the employee on several different aspects of the company and their job. Staff members should be completely familiar with the following aspects of the ambulatory care practice. And they are the vision and mission of the practice, employees' rights under federal and state laws, the code of ethics and business conduct, culture of safety, duties and their benefits, telephone and computer security, the Health Insurance Portability and Accountability Act, also known as HIPAA. Moving on to the next slide, ethical business practices. There needs to be an active program in the ambulatory care practice to prevent fraud and abuse. If a practice hires a third party to do their billing, Medicare requires that all payments be made direct deposit to the practice's account only. If the Patient Protection and Affordable Care Act requires all healthcare providers and facilities to have a compliance program in place that they follow. Next slide, ethical business practices. These are some of the steps that they must follow to help prevent fraud when billing charges to the insurance companies. Provide clear documentation of the diagnoses and services that were provided that day. Promptly return any overpayments to the insurance company within the respected timelines that they give you. Verify every patient's identity, especially when extending credit to them to help prevent identity fraud. If not, you could be collecting money from possibly the wrong person. When ordering DME, durable medical equipment, be sure only to order it after a doctor has done a face-to-face exam with the patient and confirm that the patient does need that specific equipment. Next slide is high-risk areas and misdiagnosis. There are numerous areas in the clinical ambulatory setting that need special attention. Misdiagnosis, medication risk, infection risk, communication, and documentation. There are very high percentages of diagnosis mistakes made by physicians and nurses in 3 specific fields, meaning there is either a delay in the diagnosis or failure to diagnose them. The 3 fields are breast, lung, and colorectum. This information was put together with all the malpractice claims and the insurance companies who have been paying the malpractice claims. The next slide is high-risk areas and misdiagnosis. If some of these patients would have had certain testing done when they went to see their doctor, instead of the doctor assuming that it was menopause, then they could have found out that they had cancer months or even years sooner. There are thousands of cases of patients who have experienced this type of missed diagnosis, which often has ruined their lives. These have been very sad stories to read, knowing that they could have been prevented. The next slide is medication risk. According to a PIAA report, the single most common basis for malpractice claims, which includes about 5% of them, are based on the patient being harmed because of a medication error. Such errors could include prescribing the wrong dosage, prescribing a medication that you know the patient is allergic to, failing to monitor the side effects of any of the medications, failing to provide clear instructions to the patients on how and when to take the medication. Next slide, medication risk. There were nearly 2/3 of the PIAA claims for fatal drug There were nearly 2/3 of the PIAA claims for fatal drug allergies, and when the patient's charts were audited, it was clearly documented in the patient's chart that they had that allergy. So basically, the doctor did not completely read through the patient's chart to see that they had that allergy. Making sure the documentation is clear and detailed is a good way to help minimize any risk or harm to the patient. Communication issues. There was a $70 million increase in malpractice claims from 1991 to 2010 because of the breakdown in communication, whether it was communication with patients, nurses, or other staff members. Communication was severely lacking, leading to more accidents. The most common error was not telling patients of the results of their tests, giving the patients the wrong test information, and failing to notify the primary care physicians or the referring physicians of the test results of the patients. Next slide is communication issues. Doctors have to take the time to explain in detail everything to the patients, whether it's a medication test, a medication change, a lab, or a test result. This way, the patient has a full understanding of everything. The doctor also needs to make sure he documents everything that they discussed and went over in detail. He can not miss any details. It cannot be stressed enough that that having detailed documentation is what will help protect doctors if something were to happen. Having poor communication with other doctors is a recipe for disaster. There was a study that over 50,000 malpractice claims came from a primary care physicians that were not communicating to other physicians about the patient's results. Next slide, documentation. Having great detailed documentation is essential for managing risk in the ambulatory setting. Electronic medical record systems are very useful for all facilities. They are able to create templates so staff can just complete the information instead of having to completely write it out. Doctors can electronically submit prescriptions to the pharmacies, which help both the doctors and the patients. The next slide is office management, administration, and personnel. Having a specific individual assigned as a manager to be in charge of basically everything from dealing with the patients to helping with employees with paid time off and benefits is very important to have. Depending on how big the company is will determine if they will have a special department in charge of the entire hiring process for their employees, which includes the paperwork that needs to be done and filled out, copies of IDs and social security cards, the background checks, the drug screenings. Quality improvement department is important to help conduct and to do an inside audits to help prevent billing mistakes or fix mistakes that have already been billed out. The next slide is the conclusion. This chapter talked a great deal about how important it is to take care of your patients. Having detailed documentation on each and every date of service with them. There are so many malpractice lawsuits than there has ever been because of so many doctors and nurses being negligent while they were working. When people's lives are relying on you and you are not able to provide them with the best care, I do not believe you are in the right field. Always remember to treat everyone how you want to be treated, how you want your parents treated or your children treated. The next slide is my discussion question. How do you feel about the evolving ambulatory healthcare system? And what is your opinion on all the different malpractice lawsuit cases that are happening so frequently now? Thank you so much, you guys. Have a great night.